All right, this is the audience.
Imagine waking up one morning to find a reddish, scaly patch of skin on your body that may be even itchy or burning. What could it be, you may wonder? Well, it could be psoriasis. Don't worry though, because it's not contagious. Psoriasis is a chronic autoimmune disease that has a number of different causes, different symptoms, and various treatments. I know a lot about psoriasis because my mom and grandpa have lived with this disease for years, and I have also done some research of my own. What is psoriasis? When I say that psoriasis is a chronic autoimmune disease, I mean that the immune system attacks healthy body tissue and that there is no cure. In other words, the immune system is making a mistake and going after a disease on my skin that is not even there. This then will motivate the skin cells to reproduce at an extremely rapid rate, causing the skin to become inflamed, red, and scaly. According to the Centers for Disease Control and Prevention, psoriasis can be commonly found on the elbows, knees, and scalp. Although these are the most common areas, psoriasis can also appear virtually anywhere on your body, even on the fingernails and toenails. Psoriasis can come in a few different forms, but the most common are plaque and guttate. This is a picture of plaque psoriasis, and this is a picture of guttate psoriasis. As you can see, the plaque psoriasis covers a much larger area than the guttate psoriasis, which is like small dots. You may be curious as to what causes such a disease. Well, according to the Mayo Clinic, the cause of psoriasis is not fully known. Though there is not a known cause, there are things that are thought to trigger the disease. Psoriasis can be passed to you through genetics. If your mom or dad has it, there is a large chance that you may acquire it throughout your lifetime. Bacterial or viral infections, cancer, stress, changes in weather, smoking, cuts, bites, burns, and increased alcohol intake can also trigger psoriasis. There is an equal risk for both men and women, but it seems to be more common in adults than in children, but that is not to say that children never get the disease. Additionally, there are many symptoms of psoriasis. The most common is the red or pink areas of thickened and scaling skin. These patches can burn or itch severely. You will also notice that the skin can be dry and cracked around the affected areas. You may also experience a sore sensation on the patches of the skin. Believe it or not, psoriasis can also affect your mobility, which it is then called psoriatic arthritis. This causes stiff and swollen joints and affects 10 to 20% of people with regular psoriasis. Like I stated before, there is unfortunately no known cure for psoriasis, but this disease can definitely be maintained through proper treatment. First, you need to see a dermatologist. Then, you and your doctor should come up with a treatment plan that best suits you. Although there is no cure, there are many treatments like biological drugs, light therapy, and topical creams. Biological drugs are drugs that alter the immune system that often come in form of a shot that is injected into your muscle. Some common examples of a biological drug would be Enbrel, Humira, and Stelara. Biological drugs are used for people who have failed to respond to traditional therapy because they can permit life-threatening infections and are very dangerous, so doctors like to use them as the very last option. They work by blocking communication between certain immune system cells and inflammatory pathways. Light therapy uses natural or artificial light by means of sunlight or phototherapy like a light box. Common topical treatments include salicylic acid, coal tar, steroid creams, and your standard moisturizers. I talked about my mom earlier, how she has psoriasis, so now I'd like to ask her to come up here to talk about it.
my psoriasis currently is on my elbows, a little on my knees. It's not that bad. Avery talked about them being thick. Mine are thin right now, probably because I've been swimming in our pool. She talked about a treatment, salicylic acid, that will thin out the patch. Our pool is a saltwater pool. That helps to thin out the patches. So they're thin. Mostly mine has been plaques. When I was younger, I would have the gut tape, the spots, but mostly it's just my knees and elbows, and no psoriatic arthritis. So my dad had it. He's passed away. We don't know if his parents may have had it.
So what triggered your psoriasis?
I got my psoriasis first in college, around exam time.
Stress.
Yes, I think it was stress, and I was obviously predisposed, so it was in me to begin with. The stress probably brought it out, and it never went away.
Okay, thank you. Overall, psoriasis is a chronic autoimmune disease that affects many people in the entire world. As you can see, it is a very diverse disease. Psoriasis can come in many different shapes and sizes, but there is no need to be afraid because luckily, this disease is not contagious. There are many causes, symptoms, and treatments. People that have psoriasis should not get discouraged since there is no cure because there are many doctors and treatments that are willing to fight the battle right along with you.